In your decades of working with families, when they first come to see you, do they necessarily understand that there is a serious problem?
I think the operative word would be serious. I think that they may understand that there might be a problem, and not everybody in the family may even be thinking that there's a problem, but they're at least willing to walk through the door.
And what does it take for a family then to realize, okay, we have a serious problem on our hands here and we need to address it?
I think that the dominant thing that people would need is really education. There's no quick fix when it comes to addiction because it's really a chronic illness that needs to be addressed in an ongoing way.
This is a family problem, isn't it?
Yes, it is, because there's a very strong relational interplay between the person who has the addiction and what happens to the family in response to the person having the addiction. It alters all the people around the person. And by that, I mean that really it's a relational problem, and any one of the people in the system can go and get help. So if I'm the mother of somebody who has a drug problem, I don't have to wait for them to go get help. I can go get help to learn how to deal with it differently. And some of the examples I give to families often is that if you and I are playing tennis and I'm always hitting the ball to you this way, you're going to eventually stand on that side of the court. But if I go get help and learn, well, I'm going to start going that way, I am, by doing this, moving you in a different direction.
So speaking of family systems, when parents come in to see you or a family comes in to see you, what are some of the first questions you might ask them during a family assessment?
Well, the first question that I probably want to know is if there's a pattern or family history of addiction. And the reason I'm asking that is because I really want to understand the genetic predisposition, because to a certain extent, addiction is a genetic disorder. And that, again, is a very powerful piece of information to reduce the family blaming the addict for the problem, but to understand that it's more of a genetic condition.
So in addition to eye color, hair color, build, we can also pass on the disease of addiction.
As somebody once said to me, everybody passes on something. We pass on heart disease, cancer, all sorts of, problems, and, we don't select them.
Have you found that there's usually one parent who enables more than the other?
Mm-hmm. Enabling has a bad connotation, but it comes from a loving spot. It's just like love gone awry. So, if I have a kid who has something wrong, I'm going to say, don't worry, I'll take care of this. What happens with addiction is that the kid keeps getting into more and more trouble, and the parent keeps rescuing, taking care of it. I'll do your work for you for school, keep you on track. You'll outgrow it.
You have said in the past that it is important to start with the parent who wanted to get the child help first and then deal with the more reluctant parent. Could you expand on that?
Same analogy as the tennis game that I gave you. If you start to shift one member, then you're going to shift the whole system around, because that one parent can actually put pressure, not even on the addict yet, but on the other parent to join me in figuring out how to help him or her.
How big of an issue is parental guilt? This is my fault. Where did I go wrong? How could this have happened? Am I to blame? That kind of thing.
Well, I think parental guilt is part of anybody's issue, regardless of what the issue is, right? Which is, if I could replay the tape, how could I basically reparent my child from a perspective I have now that I've evolved? But nobody can do that. In terms of the guilt, it goes back to the genetics. Did I pass it on? Is it even my own parents' fault that I was raised the way I did, and so I raised my kid this way? And the kid, of course, knows to play the parental guilt, right? Because it can become a touchstone to manipulate. If I could convince you that it's your fault that I'm using, I'm not dealing with my own issue, I'm dealing with you.
But what about other family members, such as siblings? To what extent are they affected by this?
Yeah, well, siblings are affected in multiple different ways. I mean, there's the caring and the fear and the terror that something's going to happen to my sibling. But there's also the feeling that nothing I do is really commanding center stage for my family. where addiction is sucking out the life force through one person and the focus of everybody onto that person. The whole family's frazzled. I mean, none of these roles are getting nurtured. That's really what starts to happen is the capacity, which is no fault of the family, but their ability to really be there for any single one person is diminished by being in an active state of crisis almost all the time.
Is therapy beneficial for every family?
Well, that's a great question. But I would say that as a starting point, and from a most optimistic point of view, I would say it's certainly worth the try. It's certainly worth the try to realign the parents, see the patterns that are occurring between the members of the family, and affect change in a more longitudinal way. Because to just take the addict out alone and treat them and not treat the family and then reassert them back into the family is to create the same set of dynamics that contributed to the addiction in the first place. So I do think it's fundamental that the family really try to go together to get help.
What do you love most about working with families?
The possibility. It's a three-dimensional game of chess. When you're working with a family, you have infinite possibilities to affect change in a way that if you're resistant, I don't have to go directly to you. I could go to them and help them to respond differently. So I love that part.
What I like to tell people is that hope is real. Mm-hmm. Help is available. You can do this. For parents watching this right now, It might be 2 a.m. and they're scared.
Yeah.
And they feel helpless and they literally don't know what to do. What message do you have for them?
I think that what you want to do is turn the crisis into the opportunity and make it into a blessing, and that the family relationships ultimately are going to walk away with greater depth, greater capacity, greater understanding for each other. But you have to go through the process to get there. But yes, I do think recovery is a blessing for any family to have.